On the phone with us is Kim Detay, Public Information Officer for the Wyoming Department of Health. Thanks for joining us this morning.
Oh, I'm glad to join you.
So before we get into the bulk of the questions I have for you, I have to ask about being a public information officer at a time like this. What kind of a team do you have? How many people are on that team? And what exactly are you dealing with as far as keeping the information straight?
Well, it's been very busy, as you might expect, but there are a lot of people involved in this whole situation that are working a whole lot harder than I am.
All right. So the information that you're putting out there, there's reality versus the rumor mill.
There can be a bit of both.
Okay. And so how do you deal with the rumor mill?
You know, what we try to do is just be consistent and credible in the information that we provide, and we encourage people to look for credible sources. We encourage folks to look at our website, which is health.wyo.gov. Of course, we communicate with our friends in the media to help share information as well. And as far as even more information from the federal government, we do suggest people look for details, and there are a lot of them available from the Centers for Disease Control and Prevention. That's the CDC that we hear about. There's also a great Wyoming state government website at covid19.wyo.gov. That has information about some of the broader resources for Wyoming in this response beyond the health aspects.
Let's talk about testing in the state of Wyoming, because nationwide there's been a bit of a shortage on test kits. How are we doing in the state of Wyoming?
So testing is a complicated thing. So if you'll let me explain that a little bit. And I think there's been some confusion. So one of the things that happens is there's a difference between sample collection and then actually testing that sample. And so people keep saying test kits. And for us, that means what the materials that we received weeks ago from the Centers for Disease Control to actually run the testing in our high-tech lab of the samples that were collected. So it's a complex process, the actual testing, but someone goes to the doctor, there's a swab, then that's sent to our lab in Cheyenne. There's really no instant or quick testing option. Samples can be sent either to our lab, it's called the Wyoming Public Health Laboratory, that's part of our department, and then some samples have also been sent to private labs. So I know that it feels like this has been going on a really long time, but really this is a new disease, and it was only identified 3 months ago, and our lab started testing March 5th. They were able to do a few a day back then, and they've done an amazing job. One day last week they ran almost 200 tests. They've been keeping up, and they don't have a backlog. So we've been doing it quickly, but we know that private labs, it took them a little longer to get up and running and going, and their turnaround times have been a concern. So we have the materials we need to run the test on the samples sent to us, and believe for now we're still in good shape on that. But we know that many doctors' offices and hospitals across the state have had trouble with what we would call more the sample collection kits that they have on hand. And unfortunately, that's not just a problem in Wyoming. It's something that's being faced all over the country.
And Kim, if I could jump in here, how is your department working with local governments in Wyoming, counties, and the federal government to acquire and then distribute these, sample collection kits?
So there's a couple things that are going on. We do the guidance for testing has changed at different points, and some of that's been about capacity to manage that. We've also worked with them. We did receive some materials last week from the federal government, and then some folks at our lab took those materials and they put together it was about 2,700 sample collection kits, and those are distributed out to the counties to help to increase their supplies locally. We're trying to order more supplies, and we continue to look at other options, as technology and some of the different things might become available. But it's a challenge. This is a pandemic. And the problem with the pandemic is that everyone wants the same things at the same times across the country, and really in some ways across the world, too.
You know, Governor Mark Gordon was one of a number of public officials who in the last couple of weeks has made the point that, look, beyond what we're able to test, we don't know how far this virus has spread in
Right.
communities across our state. I guess there really is no way to know. He says the numbers, the positive test results are simply not indicative of how widespread it may in fact be.
We do believe that there are likely more cases out there than what we've been able to identify. Testing is a tool. It helps us know what's going on, And for the priority situations, like someone who's in the hospital, it's especially important maybe to help with the treatment choices that a doctor might need to make for them. So we are seeing increased cases. We think that's due to more testing coming online because we have increased that, and also more presence of the disease. But there's more than one thing that we look at. We do know that there's likely more cases out there, and it's hard to come up with a number. That's true with other diseases, too. The testing that we do helps us know what's going on at a certain point in time. One of the other things we look at is hospitalization, for example. There's also ongoing communication with all the counties. What's going on in your area? What are you seeing? So there's more than one way to look at where we're at in Wyoming other than just a certain disease count, although that is helpful to know.
Sure. And, as far as some of the rumor mill and the disgruntled folks on social media with all the shutdowns, I mean, certainly, if you're a business owner, if you're an employee who's been impacted by this stuff, it's no joke. It's a bad deal. And obviously that's why we're seeing the federal stimulus. There are folks who are saying, look at the death rate of H1N1 or the common flu in a given year. Why are we so freaked out about COVID-19 today? So maybe you could lay out how COVID-19 is different from the common flu, and where can people get information about those differences?
So there's some things that we don't know. Some things we do, some things we don't. At this point, we don't know exactly how widespread this will be in Wyoming, and we don't know when we might see a peak. Part of the reason is we want to see if all the actions that we're taking that are hard on people, and everybody recognizes that, if they can help make a difference. Those tough orders, some of the actions with the follow-up that we're doing with those identified cases, all of that's meant to reduce the number of illnesses. So we're hoping to keep things from being at the worst levels. But there are some differences between flu and COVID-19. There are some similarities, too. The most important and common symptoms of COVID-19 are fever, cough, and trouble breathing. Well, obviously that can happen with influenza and other viruses, too. And, one of the things that I think is interesting, that of the testing that we have done, 95% of them are negative for COVID-19. And so that's one of the things that tells us that there's more than one illness out there that gives people some similar symptoms. But the thing that really makes this different, is that it's new. So what that means is that there's a higher potential for quick and heavy spread around the world and around the country. When there's a new virus, our bodies just aren't prepared to fight it in the same way, and there are no vaccines and there are no proven treatments available. So there can be a lot more people sick at one time, and that's what we're trying to prevent.
We're talking with Kim Detai, Public Information Officer for the Wyoming Department of Health. Kim, with a limited ability right now to test around the nation and around the state of Wyoming, let's talk about, since you said about 95% of the tests turn out to be negative, what are the signs that someone should pick up the phone and call their doctor, and what's the procedure to make sure that they are actually someone who needs to be tested?
Well, like I mentioned, there are the most common and the most important symptoms of COVID-19 are fever, cough, and trouble breathing. And if you are having real trouble breathing, if you're really in medical distress, we do want you to call 911. But, while I said earlier that this can spread to more people and spread faster, we still think the majority of people are not going to experience the kind of severe illness that we're really scared about, that does require hospitalization and does put you at higher risk for the real trouble. So that's why a lot of things are focused on the people who have the highest risk of those complications. And all of these things are meant to keep too many people out of the hospital, to save lives, to keep people out of the hospital, and to keep too many people out of the hospital at one time. So anyone can get sick with this, and really anyone has a risk of more serious illness. We can't say if you're a certain age you're safe completely, but we know who has the highest risk, and that involves people who are age 65 and older. And one of our top priorities, absolute top priority, is people who live in a nursing home or another sort of long-term care facility. That's what we've experienced up in Lander. That's been a real concern. That's the kind of thing we want to prevent going forward as much as possible. There's also high-risk conditions that things like people who have chronic lung disease. Of course, that makes sense because the people who have the most trouble with this, it ends up being definitely a breathing issue into their lungs. People with moderate or severe asthma, People who have serious heart conditions, that's another group that needs to worry. People who have trouble with their immune system, and sometimes that can be like people who are undergoing cancer treatment. And then there's severe obesity, and then you always hear the term certain underlying medical conditions, and a few of those include diabetes, particularly if it's not well managed, renal failure, or liver disease. So those are some of the folks that we're most worried about, and we really want to make sure they're doing everything they can to prevent becoming ill.
Kim, you've touched on this a couple of times. I guess before the break we were talking about preventing the spread of the disease in an effort to sort of flatten the curve, reduce the strain on the healthcare system. What does that mean to flatten the curve for folks who maybe haven't heard it directly?
So what that means is that obviously we want to reduce the number of illnesses overall, and all of the steps that we're taking are meant to do that. And we want to reduce the numbers of illness at one time so that we don't see as many severe cases and find that our healthcare system isn't overwhelmed at any one point in time. That's our best chance to save lives. And that's also the best chance to ensure that help is available for other healthcare needs too. If people need to have a reason for why it matters to them, people will still have babies, people still have heart attacks, and people still have accidents. So we want to take care of the people who are seriously ill with COVID-19, but we want healthcare to be available for everyone.
And I think a natural consequence, of course, of flattening that curve means the end of the curve is pushed out so much further, so to speak. So it just means that the pandemic we're experiencing is going to go on for a longer period. In Wyoming, where do you expect us to see the peak of that curve?
We aren't going to be able to predict that at this point. There's so many things that can play into that, and some things we don't know yet. Again, this is only a disease that people have known about for 3 months.
Sure.
So I don't have a good prediction for you on that, but we do know it's new, and that needs to be paid attention to. But it's also a respiratory disease that has similarities to other diseases that we're quite familiar with. So we know some of the things that can help prevent the spread. One of the reasons we need people to stay apart and stay away from other people is just simply how this mostly spreads. We believe people are most likely to pass the disease on to other people when they're most ill, when they're experiencing symptoms. And it's really quite basic. If you're ill with COVID-19, and this can be true with other diseases too, and you cough and sneeze, what we call respiratory droplets, and you might not always be able to see them, they come out and they spread. And when you're close to other people, that's the highest risk for transmission of the disease.
Kim Tai is the Wyoming Public Information Officer for the Department of Health. So let's make sure people have the information they need rather than the rumor mill. Where are they finding information with the Wyoming Department of Health?
Well, there are definitely some good credible news sources. We also want people to look at our website. That's at health.wyo.gov. There's a great Wyoming state government site, and that has stuff for people that are experiencing the economic issues too, and that's covid19.wyo.gov. And from the federal government, we do suggest that people look for information from the CDC.
Okay. Kim, thank you for coming on. Appreciate your time.
Thanks for joining us, Kim.
Sure.